kept this agenda to be very light, so now we can address the strategic plan to end homelessness. So, you know, we're going to have a presentation by, is it Regina?
Yes.
All right, Regina will do the presentation, and you have the floor.
Fantastic, thank you. Well, good afternoon, everyone. It's always good to be back here. I was actually thinking about getting a home here, but they're a little too expensive. No, just kidding. And so I know that the community has embarked on this journey to update, to revise your strategic plan to end homelessness as you're getting close to the very end of that 10 years. And so what we want to look at today is a draft of that. We've had a lot of community meetings, a lot of input, a little bit more to go, but we wanted to share a draft with you to get your feedback so that we are taking you sort of along every step of the way. And so here we go. We've divided it into a couple of areas. We'll give a little background information on sort of the process, walk through the data, the need, the investments, then go through the community issues that we've come up with across all of our community meetings, and then end with recommendations. And please, we want to make sure that this is as interactive as possible, so don't worry about stopping me if you have a question. I'll see your hand, so certainly stop and say, you know, I'd like to have a little bit more information about this. If it's something that I can't answer right away, we've got paper here, we'll certainly write it down so that we can get back to it. But please, we want this to be as interactive as possible. And so this is your update to your 10-year plan. And let's see, can we move it down just a little bit? I think that folks are, it's going to be a blurry. Ken, is there a way to bring it down a little bit? We need to sit it on something maybe. Perfect. Okay. And so basically what we're trying to get to is what every community across the country is trying to get to. That every community has the capacity for three different things: to quickly identify and engage people at risk of and experiencing homelessness, to intervene to prevent the loss of housing and divert people from even entering the homeless system altogether. And also, when homelessness does occur, to be able to provide immediate access to shelter and crisis services without barriers to entry, while permanent stable housing and appropriate supports are being secured, and quickly connect people to housing assistance and services that are tailored to their needs. And so those are the three overarching goals for every community, and you've adopted them as well. So sort of a process summary. So starting back, and it might have been in this building, last year, July of last year, the county held a collective impact day to begin to talk about what is collective impact, what does that mean for the community, and how do we make sure that everyone is at the table as we embark on this journey. So every sector, every stakeholder community. And so part of that, we share the progress that you all had made on your original plan to end homelessness, and just reintroduce that concept of collective impact model. And why is it so important that we talk about collective impact? A couple of things. A homeless community, and this is across the country, the homeless community are those folks that do this just on an everyday basis. If those are the only folks that are working toward ending homelessness, you'll never get there. It takes the entire community, it takes all of the sectors working together in an aligned way to get to ending homelessness. And so that's why we wanted to sort of reintroduce that concept and bring everybody along as part of this. And in late fall of 2017 and early winter, we started having all-day workshops. We were at a gym. I think some of us even got to play a little basketball. But we had a well over 100 folks there in the gym. And we had 2 days of constant community meetings and back and forth trying to figure out what are the needs, what services do we already have in the community, what else do we need more of. And so we walked through that again in April. We came together again in smaller groups. I think there were about 10 different stakeholder groups that we sat with and had smaller meetings to make sure that we were understanding where people were with this progress, what the needs are, and how they wanted to have input into this. Okay. And we also had an opportunity to have a focus group with those with lived experience. And I have to say that that was probably the most enlightening of all. When you have an opportunity to sit with folks that are actually going through this, and they tell you what the needs are, you can pretty much say that's what's needed. And so had a great opportunity to sit with folks over at the Lewis Center. And of course you've seen this a couple of times, sort of the big picture, just walking all the way through from the assessment phase to figuring out where we want to be, sort of that future picture, and then what are the gaps, and then coming back to how do you actually develop each one of those stages with all the strategies, and then we're getting toward the end now in terms of finalizing the draft, and then soon in the next couple of months we'll be able to present out again. These are definitions, of course, that you will have in your report, but one of the things that we have found out that we've all got to be on the same page, so we've all got to be speaking the same language. And so making sure that from the very beginning that we laid out how we were defining all the terminology. Okay. So, collective impact. Let's take a look at it. Okay. And so we all remember that back in the day, when there was this isolated impact, when people were doing really good things, but it was sort of all over the place, and people were just trying to get a handle on this. You know, how do we help folks who are out in the street, who are in and out of their homes? What do we do? And so a lot of these organizations started popping up everywhere. Again, doing good work, but just all over the place. And then we said, well, gosh, maybe we should come together, at least sit around the table together. And so we had all of these collaborations and coalitions to start forming, saying, well, let's come to the table and sit together and see what we can do. Even then, when we were sitting at the table, a lot of times we weren't moving in the same direction. And that's when we moved to collective impact. Because collective impact says that not only do we need to be sitting at the table together, we need to all be moving in the same direction. Otherwise, we're not going to have the same kind of impact. We're not going to be able to leverage what each organization, what each stakeholder group is doing unless we're moving in the same direction together. Okay. And for collective impact, what do you need? What are the conditions for it? So you need influential leaders. All of you who are in this room today are that. The adequate resources, of course, and then a sense of urgency. The sense that we have to get this done, that there's people's lives that are hanging in the balance, that we have this wonderful opportunity to help them, but we want to do it as quickly as possible, as thoughtfully and as strategically as possible, but certainly with a sense of urgency because these are lives that we're working with. The 5 conditions of collective impact. So just as a reminder, a common agenda, a shared vision of where it is that you're trying to go, shared measurement so that we're all collecting the same data and that we're using the same data measurements. And that's always a challenge because every sector has its own databases. It collects its information. Some folks have like a spreadsheet over here. Some folks are entering to 2 or 3 databases. So how do we make sure that we come together and have a shared way to talk about that data, and how do we actually measure our progress and the things that may not be going as well as they should be. And then mutually reinforcing activities. So making sure that we're coordinating with each other, that if you're doing an activity over here this week, that it's fitting into it, that it's certainly not going against activities that another body or entity is doing. And continuous communication, always communicating about what's going on in each one of the sectors and how we can make sure that we're linking that. So whether it's healthcare, our housing, or the criminal justice system, how are we making sure that we're in constant communication with each other and building off the work? And then that backbone support. Who's sort of the conveners? Who's making sure that things get done, that the train is actually running on time? Who is making sure that they're actually collecting that data and analyzing that data and making sure that the strategic plan gets done? So making sure that you have a backbone in place. So those 5 conditions of collective impact. So any questions there before we start looking at your systems data? Okay, let's do it. Okay, so we just took your 2017 data to look at in terms of the how many folks? 1,271 individuals, 336 family members. And we decided that to run that through a systems map. And we'll be updating this in 2 ways. And don't worry, your eyes are not bad on you. This is a lot of data, but we'll break it down a little bit. But basically what a system map does is to tell you how folks are coming into your system, the interventions that they're going into, so whether or not they're going into emergency shelter, transitional housing, and then how they're moving out of those places. Are they moving into permanent supportive housing? Are they moving into rapid rehousing? Are they going places where you don't even know, that you can't even catch up with them? And so as we've gotten in better data, we're going to be updating these maps, and we're going to also do something different. We're going to disaggregate the data by race and ethnicity and gender so that we can see if there are any disparities across those, so we can have a look at equity to make sure that all of the groups are moving through this system at the same rate and are getting what they need. And here's just an example, and we'll go through these very quickly. So you've got folks that are literally homeless. About 80% of the folks that come into an emergency shelter are literally homeless. About 20% coming from other places. When they leave that emergency shelter, 28% of those are going back into homelessness. 35% are going to unknown places. And 37% going to permanent housing. That permanent housing could be that they're getting a voucher, through the COC, or it could be that they're going to stay with families and friends. Those are the kinds of things that we have to dig in more deeply, because we want to make sure that if they're going to stay with families and friends and they're calling it permanent housing, that it is permanent. Because if your name is not on that lease, typically that's not a permanent place to be. And so these are the kinds of things that we dig more deeply into as we literally walk through everybody through the system and seeing where they're going. Over the last year, the HMIS team for the COC has been able to find out a few of the more numbers in terms of unknown. So that number is not as large as it was a year ago. So these are kinds of things that push a community to start to look at their data more carefully and go and work with their providers and say, you know what, we can't let people continue to walk out the door and we don't know where they're going. And so that makes sure that people are saying, hold up, we need to understand where you're going and why you're leaving without going to a place where you actually have a permanent home. Okay. And so we literally walk this through every single intervention for you. And I won't go through each one of those. There's some highlights that I'll show you. So we did it both for individuals as well as for families. We will update this and also, as I said, disaggregate it. Okay. And I'll get you to some of the highlights that we talked about. And so one of the things that we were looking at, if you'll look at that second one, a high number of folks, literally homeless folks engaged via outreach with an additional 18% coming from institutional setting. That's a high number of folks, okay? We want to play with that number a little bit. Unusually high number of people coming from detox and substance abuse facilities going into transitional housing. What's the issue there? Is there just this sort of set pace that if I come out of detox, I immediately have to go into transitional housing? Are we doing that just because that's the way it's always been done? Or is it because I need to go into that for some reason? And so what we want to find out is to make sure we have that number as low as possible and that people are going into permanent housing. A significant number of people were moving in with family or friends. Again, that's a red sign. That's a red flag to say if people are going to live with their families and friends and their name is not on that lease, we need to find out what's going on there. And part of that is to check for recidivism, to literally take a sampling of those names of folks who are saying that they're going to stay permanently with family and friends, and to check in 3 months, in 6 months, and 9 months, have they recidivated back into homelessness at higher rates than other folks.
Yeah, I have a question. So if they're going to live with family and friends, and they're living with family or friends who own their own home, I mean, their name's not going to be anywhere there. So is that tracked differently?
So to check, it's simply a check. If we can have the kind of aftercare where the case manager can call and say, okay, was this a reunification type situation? That absolutely, we want as much of that as possible. But if we're putting down, we're going to go and stay, with our friend, Johnny over here, and you're on the couch, and Johnny can kick you out anytime.
Okay.
So
the same goes if you're renting, right? Because
yes.
I would assume that most of these people who are homeless also probably don't have good credit, and
yes.
It's not easy to get a lease if you don't have good credit. So it's it's probably not that easy to get them on a lease as well. So I just wanted to make sure there was a way to differentiate those, so we're not counting those as homeless if they're actually living with a family member because of whatever reason, and they can be there permanently.
No, that's a great point. If it's reunification and you're with that family, absolutely. But if it's just a fly-by-night, we need to know that and watch for that recidivism, because probably we've seen in other communities that they come back into the system a lot more often. And then again, to your point in terms of the criminal histories and the credit histories and all, what some communities have been able to do are master leases, because it sometimes is really difficult to get those single leases, and so they'll do a master lease, one entity, so that folks are not as worried about having to get those individual leases because of their criminal histories or credit background specifically.
Right, and the reason I ask the question is because I know someone who is a very prominent person, not someone who is like, living below their means or whatever, but, she had a son who was, been on drugs, been homeless. Yeah. And, she brought him back home, but he was never on her lease, and she would never, she owns her own house anyway, but but he lived with her. So, he's somebody who was on the street, and now, she said he's back home, and he's been back home for a while doing well. So I was just curious about how.
Yeah, and that's what we want to see. Absolutely. Thank you. Any other questions?
Can I ask a question? Did you look at the families inside the school system? Would they be caught in the HMIS system through the county, or is the school system an independent entity that wasn't as connected to this as they should be?
So they are connected, but are they in HMIS? No, but we sit down, we had actually several sessions with the education system to find out, get a sense. So their numbers are going to always be larger because typically they're not, unless the families go to a local shelter or reach out to someone who has an HMIS, we're not going to capture them in HMIS.
So the only way they get into the system was if they were ever going to the intake for the county, or somehow they connected with the HMI system someplace else.
It's the only way that they get into HMIS. So it's not the only way that they can get services, certainly. It's just the only way that they would get into HMIS because the school system is not using HMIS yet.
Yeah, because there's two different definitions, right?
Yeah, no, I get that.
Yeah, so there are some that the school district connects with us that would be in HMIS when they're literally homeless.
Okay.
But when they're doubled up, that's where the difference.
The different definitions, and again, you're going to have, it's going to be a lot higher. But when you want to look at just the totality of people who need more stable housing, certainly you want to look at that number. When you're looking at literally homeless, that definition, that specific HUD definition, then that becomes a subset of just a larger group of folks who need more stable housing.
And person that might be not an American citizen, are they tracked in this system also, or are you capturing any of that data?
So you mean undocumented?
Yes.
So every community decides how they do that differently. I can't, unfortunately as a HUD TA, I can't say, but I don't know if you want to share how you all are capturing undocumented.
Not right now. No comment.
And they're also ducking.
James, how did we get you I know we sent over a bunch of data. How was that included for the school district?
So that data is included in our prevention strategy. So that list that you have on the board there, and the way that we've been engaging our faith-based community, we've been taking that, we dropped it into a heat map and showed where the dense populations of homelessness are. We overlaid that with where the churches were, and we're going out and we're getting our churches to help us on the prevention end. So if they hit the streets, then we'll have churches to help out, because a lot of times they don't meet the definition of chronic homelessness, but we have churches that provide rental assistance, they provide like family promise housing, things of that nature. So we're leveraging those resources with that list.
Okay.
And then certainly that list is helpful for us to see, because they're prevention, and oftentimes there are some individuals on that list who are also in our homeless system as well. The ones that are in shelters, they may be in HMIS on our list, and there are some who are actually sleeping in their cars, right? So that list helps us to be able to identify those numbers and to really reach out to those individuals.
And Jeff, it's my understanding that we include undocumented people in our list.
Yes,
So.
I do that.
And just quickly while we're on that subject, one of the things that we've been doing, our organizations that I've been working with in terms of the 2020 census coming up, is making sure that no matter what database they're already in, but that any of our undocumented folks are counted for the 2020 census. So just putting that out there, that has been a contention across the community. At the end of the day, every community is going to need resources to take care of everyone that is in front of them. So making sure that folks are participating in that 2020 census. So that's a little bit of an aside, but incredibly important. So understanding the need. And so there are a lot of needs, and we'll talk about some of the service needs as we go on, but we wanted to start with housing because that is the biggest need and the most expensive need. And we look specifically at supportive housing. And so what is supportive housing? Supportive housing specifically looks at not only affordable housing and for folks that are making that, an SSI check maybe, for $736.43 a month, but also the requisite services that are needed so that they can not only stabilize in their housing, maintain that housing as well as to thrive in that housing and to go through any recovery if in appropriate situations. So that's what we're looking at when we say the need for supportive housing. And so we do a projection using your local data. We walked through and did a projection for supportive housing. Again, you'll see this up close in your reports, but I'll show you a little breakdown of it. So this is sort of the population, and the only one that's unduplicated happens to be the homeless individuals and families, and which at that time included 114 veterans. I believe that number has come down now. But this is the supportive housing need. And then child welfare engaged families, 346. The criminal justice involved, that number is high all across the country. And why? We know for a fact that our prison systems and some of our larger jails, they serve as mental health institutions. Those are the largest one across the country. And so when folks get out of that and they're struggling, and because they have that history now, and they can't get a job because of this history, so they're in need, of that supportive house. So that's why that number is so high. But each community tries to define specifically of that criminal justice population, those that are returning home, how many of those actually need supportive housing. And so here you all are part of a FUSE project, which looks at how many times folks that are incarcerated are touching other systems as well, like your behavioral health system, like with Southeast. And so that number was 166, so it's a smaller number. But yeah, but that top number is high in every community, so don't be afraid. It's simply because so many folks, unfortunately, and still to this day, get locked up because of behaviors associated with behavioral health. With mental illness. So this is the list in terms of supportive housing need. Okay. Any questions there? Okay. And then investments. So after you get a sense of what the needs are, then what's already being invested? What's the community already doing? And so one of the ways that we capture that is to look at how much money is going into the system and for what. And so this is our total financial investment. For case management, you can see about $4.5 million. Emergency shelter, $3 million. Our employment, looking at just the homeless only, right around $400,000. But what I want you to see is to look at our permanent supportive housing. And so we're looking at around $7 million. We know that that's not enough. If you were just to add up how much supportive housing is needed, how much permanent supportive housing is needed, and what you would even pay for fair market, multiply that times 12, you know that you need a lot more than that, with rapid rehousing as well, and with prevention and diversion. And so just to give you a sense, and we're still, what you see here, that's highest number of mental health services, and certainly they cost the most, psychiatric visits, but what we're doing, along with Southeast, is making sure that we carve out exactly what the homeless numbers are, those that are accessing mental health numbers who are specifically homeless, and that number will probably come down some. Okay. But as you can see, sort of the imbalance of your housing prevention. So you've got prevention and diversion over here, rapid rehousing. You got substance addiction treatment, but here's your permanent supportive housing. And so we know that there has to be a lot more investment in that. And I know that the community is working toward that, and we have a lot of strategies up here that you all have talked about moving toward to build that number, build that volume of housing pipeline. And just another way to look at it, again, this big one around mental health, which we'll begin to really dig into to see how much of that our homeless individuals are actually accessing. And so if we pull out just your housing interventions, this is what it looks like currently. Permanent supportive housing at 38%, rapid rehousing 21%, emergency shelter 16%, prevention diversion 14%, transitional housing 11%. So currently, this is what your investments in housing interventions look like. And we know that the goal is to make a bigger piece of that pie into permanent supportive housing and rapid rehousing. And so what did the community say were the biggest needs? And so we had a lot of different community meetings and working with the different stakeholder groups. And so these are just some of those that are listed out. So not only do we have the community-wide meetings where you had over 100 folks in several of those days, but then we have the smaller group breakouts. And the common threads that we found among all of those groups that we talked to. These are the things that they wanted to look at specifically: community engagement, ensuring that the entire community was made aware of the extent and complexity of ending homelessness. You know, if you were to go, you all are in this all the time, but if you were to go and talk to your friends or your neighbors and you ask them, what do you know about homelessness? They probably couldn't tell you much, other than, well, we see them on the street, or, well, isn't there a shelter somewhere, or can't they go to the Lewis Center? A lot of times they don't even make the connection that it's housing, long-term housing, like the same kind of housing that you go to every night. And a lot of times it seems so, you know, it's so logical, and that connection is not there. All the services that many folks may need. They're seeing specific behaviors out on the street, and they're wondering what's wrong with this person, not thinking, okay, well, this mental illness, and we've got to treat that. Not sort of put somebody in a corner, but there has to be treatment, and there's a cost to that. And so really helping the community to understand the complexity and to be involved in the solutions, like coming up with what are those resources, how can we pull down resources, how can we make sure that we're utilizing our resources to the best, work of it. And then collaboration, making sure that we're actually working across different sectors, that you get people to break down those barriers and begin to share their different perspectives and to brainstorm and figure out how can we do this together to be as inclusive as possible. Okay? And not just your usual suspects, but your unusual suspects as well. So looking at not only, say, now it's pretty typical to have hospitals and healthcare at the table because they understand, you know, that housing is healthcare, but we're talking about making sure that you have your university systems, you know, and your public health departments at the table. So it's looking beyond just the usual. Okay? And then coordinating, making sure that there's real coordination, that you have an entity that can coordinate all those things. So like we said at first, we can get folks to the table, but we've got to coordinate how they're working together, and then being creative. I think a lot of times that we don't do as much, we're not as creative when we talk about homelessness because it's such a grave issue, you know, and it's sort of like just 1, 2, 3, we get some housing and services. But to really brainstorm and be as innovative as possible in how we're coming up with the kind of housing that's needed. So whether it's looking at, you know, shared housing like they did in the wonderful youth challenge that they were doing, or whatever those different ways that you can look at, how do you build houses more efficiently, or smaller homes, but looking at different ways to get to those services and housing that's needed. I'll stop there for questions. I know it's the end of day, but we're pushing through. And then, so the issue areas that were that came to the top, when the members of the community were asked to sort of vote on them. So we had literally around the gym had just paper after paper of all the different things that were needed. And we asked those folks to go up and vote on what they thought were priority issues. And then we brought those priority issues back to those smaller groups. But these were the ones that came to the top, the bigger overarching things. Healthcare that we need additionally to focus on healthcare, primary care, behavioral health, and then permanent supportive housing across all populations, and more affordable housing in general, especially for our seniors and our young adults. And of course, there are many different areas that came up, and we'll talk about some of those. And so specifically, they've narrowed it down to 3 top ones. Additional mental health services to bridge and close gaps between engagement of someone, you know, out on the street and the psychiatric evaluation care that they need. So bringing on more psychiatric services. Increasing the permanent supportive housing across all of the vulnerable populations, whether it be your seniors, your SMI, IDD families, or chronically homeless, and then increasing affordable housing opportunities for youth, seniors, and families. And this, don't worry about not being able to see it, but what we wanted you to see was the community was completely engaged. They came up with issue after issue that we need to address at some time. So we've got to work through. So we had to prioritize some of them, but we don't want to let these go because these are things that the community is seeing our needs. And so just to give you an idea of the kind of work that the community has put in over the last few months. Okay? And then, so let's get to the recommendations before we lose everybody here. Okay. So recommendation issue areas around healthcare, primary care. Then we'll do some with the permanent supportive housing, supportive services, community engagement, funding realignment, and our assistance level recommendations. Okay? So starting with our healthcare, here are the recommendations. Enhance the hospital engagement with homeless service providers to participate in the coordinated entry system and have plans for discharge. so that we don't get to the place where still people are walking out of the hospital and they have no place to go, or that they're still too sick. They may not be sick enough to stay overnight again over and over in the hospital, but they don't need to be out on the street again, and they certainly don't need to be living in their cars. So what do we do in the interim, and how do we begin to address the lack of respite beds for those folks? Okay. Developing an integrated approach to behavioral and physical health care, and also in terms of treatment. You send people over here for your treatment, you go over here for your mental health, you go over here for your addictions. I'm homeless. Are you kidding me? And you're sending me all over the place? How do we begin to have an integrated plan so that it is one plan that people are following, and that we have skilled service providers that understand how those two are linked and integrated? Okay. Creating strategies for obtaining benefits and regaining benefits when they're leaving institutions. And so if someone unfortunately has to go into the criminal justice system for an extended period, and all of a sudden the benefits drop off that they might have been getting, how do we make sure that we're reestablishing that while they're there? How do we make sure that we have SOARS workers that are going to the institutions, that are going to hospitals, that are going to your jails, or any place that people have to go into, your addiction or your recovery services for long lengths of time, and somehow they get disconnected from their benefits? How do we make sure that we're re-engaging? And then, of course, finding ways to increase, again, the psychiatric services. Critical. Okay. Creating healthcare strategies with a focus on housing. And this is happening across the country, but it needs to happen even more. That hospitals and healthcare systems have to be engaged in housing. Otherwise, all the good work that they do in the hospitals or in the FQACs or in those healthcare facilities, it will be for naught, because if people walk back on the street and they don't have that maintenance and folks to actually help them whether it's medication or any of the other things they need, sometimes even redressing a wound, those things, all of that good work is going to be for naught. So making sure that here locally that your hospitals are fully engaged with the housing process and are bringing to the table the kinds of investments that are needed for folks to have permanent housing. Okay. Prioritizing those and investing in supportive housing for those that are medically vulnerable. So making sure that in your prioritization process, if people are medically vulnerable, you're going to be looking at folks who are literally, and here, thank goodness, it doesn't happen as much. I work in some communities where folks are so medically vulnerable, and so it's not the cold, or the weather that kills them, it's the medical part, and not having the kind of proper care in a house, in a home that they can go to. So we need to make sure that we're prioritizing them. And developing a respite care program. Every community has to have respite beds. The hospitals and our healthcare systems have to come to the table. Again, it would save the hospitals money, because these are individuals who don't need to keep staying in the hospital night after night, but they're not ready to go, and they shouldn't have to go back and live on the street or in their cars or those kinds of things. So they have to have that place to be where somebody can come and check on them during the day, make sure they're getting their medication, changing those wounds. Sorry. And establishing a committee of health entities to go ahead and just establish that committee and say, how do we make sure that we have our health care and our housing committee working together? Bless you twice. Could be a third one. And one of the things that doesn't come, and we miss a lot, we focus so much on chronically homeless individuals and about individuals that perhaps will never, go out to work at all, and we miss that there are a whole group of people, 70% of people, we want them working, those that are going through rapid rehousing, and one of the things that we forget about is dental work. That first impressions mean everything. Now, that everybody needs to have their dental work and oral care, everyone. But it's even more critical for those that are going out for work. They want to feel confident in themselves, and make that good first impression with a smile on their face. And so we have to make sure that as part of this health care that we don't leave out dental work. Okay. Creating cross-system service and funding strategies. Let's get to the heart of the matter. It's about the funding. And how do we begin to leverage all of those systems across each other? Literally coming to the table and saying, okay, you can pay for this part of the services care, we can pay for this part, and then how do we coordinate that? That's what we have to get to, okay? And we have to have people to trust those kind of relationships and sit down and do it. Like, we can't keep talking about it. We know that we need to work across sectors, but now this is the time to do it, okay? And then to track our health and economic outcomes across the systems. So how do we make sure that we're sharing that data? Going back to collective impact, sharing the data and the measurements. How are we tracking how well or how not well we're doing across both the health outcomes as well as the economic outcomes? Finding a person in your community that becomes the point person to ACA, to your state Medicaid folks, making sure that you're billing Medicaid to the absolute fullest. What are those one or two providers that already know how to bill Medicaid that you can leverage that for the entire community? Because it's a bear. It's a bear. So you're not going to be asking every single nonprofit to do that. But you have those larger ones that are doing that we may be able to leverage across the community that can do more billing. Okay. And then compiling a comprehensive list of all of the community health services that are available, and making sure that we know across all the populations, do we have the health care that we need across every single population of homelessness? And I'll stop there again. Questions or comments or thoughts looking at your health care, primary care? Yes.
Actually, my question is more for James. Since there's so many things related back to healthcare, would it make sense for us to have a person that's related to that industry on this board?
Yes, it
Do the
was.
same thing.
The first person I thought about and I reached out to yesterday was Tanner Laws,
Oh, yeah.
the Palm Beach Medical Society. I haven't heard back from her, but I know she's on a lot of boards.
Yeah.
But she's linked, and we're doing some other work together to facilitate engagement with healthcare facilities. So yes, I do, and I would love JFK. I mean, I would say probably the vast majority of individuals experiencing homelessness are either going to St. Mary's or JFK.
Mm-hmm.
The St. Mary's executive director is already on the Homeless Coalition board. CEO is already on the Homeless Coalition board, so that's great. So maybe we can get JFK's to be a part of this effort. That would be.
Well, and a kind of a follow-up question to that, do you know if there's anything that's being done specifically to create respite beds or anything that, some of these things that you mentioned is a need? Is anybody thinking along those lines in
Yes, so we actually have a meeting on September the 19th. It's going to be in the afternoon for the healthcare entities. And so we want to bring them together and to kind of not just talk about this part of the 10-year plan, but also engage them in an effort to really leverage funding. So we want to be able to show what the return on the investment will be if they're engaging in housing strategies along with us.
Great, thank you.
And it won't be the first intro. They were one of the small groups that we met with, and we talked extensively about the need for them to be investing in respite beds. So this is coming back and following up, saying we didn't forget, like we have to have these beds. Yeah.
There's a young woman who's now the medical director of the healthcare taxing district, and she would be your contact.
Oh, Darcy?
No, it's the young woman
Medical director?
who worked with John on the when they put the.
Oh, yeah, I've met her.
Yeah, there's a young woman, she would be and they, by the way, they fund all the hospitals, so they'll be at the table for you.
Good
By the way,
idea.
the hospitals, and two examples, you did two seniors. There was a woman in Bethesda, came in when she was homeless, senior, they spent $1 million on her. There was another senior in Columbia North, she was in the hospital for a year. They'll pay you for respite beds because it's cheaper for them to pay them out of the hospital than in the hospital. They will write you a check, it depends how many zeros. They have all that data they can give to you.
And we do study after study of that with hospitals to show them the cost-benefit analysis. And so a lot of times they'll say, well, it'll take too much. No, it won't. We have examples all the way across the country where literally they'll pull, say, the top 100 of uninsured folks, go in and identify those that are actually homeless, and I've not been in a community yet where the hospital hasn't, quote, lost millions and millions of dollars simply because folks are coming right back in. And we know for a fact, this is again, everything that I'm saying to you, I can back up with studies and data, that after the first 6 months and sometimes up to 9 months where the medical costs may go up slightly because if you identify or diagnose something because they are now getting proper help, but then it takes a dive and we're talking somewhere between 58 and 65% decrease in medical costs over that second year. I mean, it's a great investment for them. It's getting them to the table and showing them that. And so, and I'll talk to you, actually have some studies for you to see. We do, part of the studies that I wanted to share with you was about quality of life. So we're going to get into some of the hospital savings right after this. But I wanted to start with quality of life simply to keep reiterating that it is not just about housing and services, but it is also about living a full life and making sure that people are engaged in their community and living to the greatest potential possible. That's what equity says. Equity says creating conditions where people can live to their greatest potential. It's unleashing their promise. And so when we did a quality of life study, we had the University of Southern Indiana to go back through our data, some of the communities that we work in with SCSH. So 81% of the tenants had lived in their permanent supportive apartment for over a year. 69% reported increased school attendance for their children. 67% reported higher level of involvement in their children's education. Yes. 63% reported better relationships with family members, to your point about reunification. 53% increase in community involvement. When we gave a list of the different activities within the community and had them to check off on the ones that they went to at least on a monthly or quarterly basis, look at that, 53%. How many of us are actually participating in our communities? Just saying. 58% reported that conditions of their neighborhood was better because they were active and a part of that. So I want us to always, not only just looking at just, health outcomes and the economic outcomes, but also quality of life and how they're interacting with their families as well. And then the health outcomes. So we just did an array for you, put together 4 quick for you. So the San Francisco study we did found that 5-year survival rates of 81% in supportive housing compared to 67% who remained homeless. So we're talking about literally people living and dying. Our Seattle study found 30% reduction in alcohol use among chronic alcohol users. That number is much higher for folks just, engaging in just alcohol drinking, but we're talking about chronic alcohol use, okay? A Denver study found 50% of the tenants improved their health status and 43% had improved mental health. You can't beat that. People either going and keeping up with their medication and with their therapy sessions. That's 43%. This is just over a period of a year. Cost savings. So direct savings in San Francisco, supportive housing reduced nursing home costs by $24K. Permanent supportive Chicago, $25,000 per person per year. And I know you're saying, well, gosh, Chicago, that's so expensive. Let me share something with you. Chicago is an expensive place to live, but so is Palm Beach County. So you're going to get some pretty good cost savings as well. And their downtown emergency shelter center showed 41% in Medicaid savings just by reducing the ER visits and hospital savings. You were just saying that somebody had stayed in a hospital for a year. That's craziness when you can just invest in housing. Portland, Maine, the Medicaid costs were reduced by almost $6,000 a year per person. Okay? So we can show the hospital and the healthcare system the kind of benefits that you can get if you invest in housing. Any questions there? And this is just how we break it up when we're looking at it by studies, when we engage folks to do our studies, looking at primary care, our enabling services, and our additional health services. So these are the ones that we aggregate. Okay. And the reason I pulled this one out separately to look at because they had the most involvement with the healthcare system. I mean, the glue that they put together to bring all of their healthcare folks together, we call it our 10th decile project. And so if you have that bell curve, that 10%, that the absolute highest users of every single system, okay? And so we brought together collaboration of health, our hospitals, our FQHCs, and homeless services. We had our health homes and our permanent supportive housing, and this was the outcomes over the year. 51% screened were enrolled. We had 47% were housed in 6 months. 98% stayed in house for 2 years. Average cost reduction was $54K to the public sector. And the reason we wanted to look at Los Angeles because Los Angeles County is so big that they see it. So a lot of people say, well, do we really see the savings at the local level? When your county looks across all of its systems, yes, you see it. So do you have to go through some data matching and some data sharing? Sure you do. But to get to those kind of savings, I think it's worth it. Okay? And so we showed that even at the local level, at the county level, that there are savings. And then for the second area that we looked at, the priority area around support services. The strategies are the needs that came up in terms of recommendations. Increase the number of case managers to support high-need clients, that there needed to be a lot more of case managers that could support those with the most acute needs. Expanding the number of peer support specialists. That's part of your sustainability package. Our goal is that even folks who come in with the highest needs, whether it's in 18 months or in 2 months, that they will need that kind of intense care all the time, and that it's a peer support specialist that can work most often with them, checking in with them, and it's at a cheaper cost or a less expensive cost, and it's also paid through Medicaid. Something like 90% of all the peer support specialist functions are actually paid through Medicaid, and Medicaid in Florida. And operationalize trauma-informed care access all across all the populations. That is no longer like sort of even an option for everyone to be trained in trauma-informed care, because we know now that well over 80% of all females that come into the homeless system have a background of some trauma or abuse in their background, in their history. And so we have to make sure that from the time someone is engaged all the way through long-term case management, that we are fully understanding that kind of trauma. Okay. And then one of the other recommendations to making sure that we're improving our preventive health care for seniors, because we know that as folks age, that their bodies begin to see a little bit more decline, and we want to make sure that we're taking care of them with preventive health care. Okay. So any questions about our support services recommendations? Okay. Recommendations around community engagement. So even outreach to neighborhood associations, one of the things that we get, especially when we go into our communities and we start looking at development, of course there is Mr. NIMBY. He is standing at the door. And so how do we sort of head off a little bit of that? But it's making sure that we're engaging even the neighborhood associations and helping them to be a part of the solutions. Are we gonna always have NIMBYism somewhere? But certainly the goal is to try to minimize it as much as possible. And one of the ways to do that is to engage more with our neighborhood associations. Okay? Creating communication strategies with our faith communities. And I know there have been several really wonderful meetings with your faith communities, and even have some things on the wall that they've already committed to doing. So making sure that we are always connecting with the communities of faith. I mean, let's face it, when homelessness just exploded, some decades ago, it was the faith community that said we have to do something about this. And somewhere along the way, they sort of got separated from the nonprofits that sort of growing up around homelessness, and we need to make sure that we're integrating our communities of faith back into it. Developing and approaching our messages to the business community, making sure that they understand the role that they play. So it's not about just get from in front of my business, but how can they bring resources to bear, and what's sort of the give and take for them as well. And then we pulled out our faith-based organizations because there was so much work that had already been done here. So establishing those faith-based entities, and that's not just West Palm Beach, the city, but the county as well. Our faith leaders, getting them to attend or host resource fairs, coordinating their calendars so that we understand what's going on with them, and then leveraging their volunteers. A lot of times the communities of faith have so many volunteers that we can bring to bear, not just at point in time night, but all throughout the year, that there are things that they can be doing, especially around hosting those resource fairs. Okay. State advocacy, recommendations around state advocacy. Working with our state agencies on identifying an ongoing funding plan for gaps in funding services for non-Medicaid eligible services. Okay? We have to work with your state agencies to do that. Developing a funders collaborative committee to put together what are the policy changes that need to take place, and making sure that they're going to Tallahassee, and then even locally, what are the policies locally and at the state level that this organization can champion. And the reason we said the Funders Collaborative, this is one of the things that they said that they would do. We met with them as a small group, and they said they wanted to take on more advocacy. So it's making sure that they have an understanding of what the needs are around policy change. And then encouraging the state to include assessments for risk of homelessness in their discharge planning process. So even from the state level, making sure that every entity, every sector has to have discharge planning. That if you're getting any kind of state money, that you have to have a discharge plan that doesn't have people going back into homelessness. And then developing policies targeting homeless families and assisting with better coordination of services. That has to happen at the state level, across all of those different departments. Where do you fit in? It's through advocacy. It's through saying that this is what our community needs, and then joining with other communities and going to the state and all of those state conventions. There was just a meeting with ACA on last week. There are more regional meetings coming up. You have to have representatives at those meetings to make sure that your community has its needs being told to those folks at the state level. I'll stop there. Any questions around these recommendations?
Is the, I may have missed it, the advocacy around Sadowski Trust Fund?
Around the funding for the housing, but we can put that specifically.
Okay.
And because I know that there have been some bills that have been put forth to try to get it to not be swept.
Yes.
To actually to keep it concrete and not that every time anything else comes up, that that's the immediate go-to, that it is not swept. Again, a show of support. When those kinds of things are voted on, and I know everybody's busy, but that's where your communities of faith, if they can possibly get a whole busload of people to go up there and standing there while those kinds of bills are being voted on, because that's the first place they come to, is your housing trust, and they're gonna sweep it every time unless that bill is passed and said no, that this has to be protected or a percentage has to be protected. Education and paths to employment. These were the strategies around that. So working with our graduating seniors experiencing homelessness so that they understand what's available to them. We had a great small work session with a small group of folks from your local colleges and as K through 12 as well. And we realized that most of the seniors, the counselors in the schools didn't know about the programs at their local colleges. That folks' lives, their educational lives, don't have to stop after high school just because they happen to be experiencing homelessness or they're in a precarious situation with their families, that there are ways for them to continue their education. And so hopefully to break out of that generational poverty. Okay. Working with universities to actually establish pools of rental subsidies. We're seeing this not as quickly as we'd like, but we're seeing this to sort of take hold across the country, where there are universities and especially community colleges where they realize, gosh, we've got a lot of students that are living in their cars. We have to do something about it. And even though they may be a commuter, community college, they're beginning to put together a subsidy pool so that their folks will not have to live in their cars and continue their education. And of course, being able to make that 4-year commitment, just like someone else would get a scholarship, to make sure that they know that they can get through, whether it's a community college, for 2 years, an associate's degree, or all the way through a university, but being able to make that commitment to them. Okay. Before we go into the biggie, the last one around housing, any questions? So these are the housing recommendations for part of the strategic plan. To develop a countywide housing strategy across the full spectrum of housing subsidy and services need. That is the key. And so that's what we started with. We'll put it together in terms of our supportive housing, so we know the needs on that. There's always an emphasis on workforce housing, but we want to make sure that people understand that supportive housing is not workforce housing. Workforce housing is for a different income level. The folks that you're talking about, that we're talking about in this room, need housing that they can afford, that ELI, extremely low income, and let's add another E, extremely low income. And so making sure that when any county puts together its full-scale housing plan, that they're looking across the spectrum, that they're not leaving this area out, that 10th percentile over here, not jumping immediately to the workforce housing. Figuring out how to bring all your cities together in that process, and I know that the National League of Cities was doing some work here as well. And then designating a person to assess the impact of the new qualified opportunity zones. How many of you all are familiar with those new opportunity zones? And so making sure that you're a part of that. That's an opportunity for huge investments in places that have not been resourced in the past in terms of building up, whether it's retail or retail and housing. You've got to get in on the front end to shape how those zones are going to be used, because let me tell you, especially in a county like this, you're going to have investors from all over the country who are racing here to build up in this area. If you're not there to shape the investment of it, you're just going to get more and more gentrified area or expensive areas, and there's not going to be the places that folks can afford to live. And so it's an amazing opportunity. You just got to be a part of it and engage. Okay? Engaging in formal partnership with your base organizations that have surplus land, you know, or that they have places that they can give land for a very a cheap price. Making sure that you understand the zoning that prevents the kind of building, the kind of zoning that you need to build more supportive housing, to build more affordable housing, and that's advocacy on a local level. Okay. Fully utilizing your permanent housing authority's ability to have preferences for homeless individuals, and establishing a person or entity that's focused specifically on developing a supportive housing pipeline. We could just stop right there. For this, you have to have an entity that's what they're doing, developing the projects. And you need one project working in parallel. Because it can take a supportive housing, if you're developing one, it may take you 18 months, 2 years, sometimes even longer. And so you want projects in parallel, but you have to have someone that's their job, that's what they eat, breathe, you know, everything that they do, it's all about developing that pipeline to meet that need that we've established. These are just some of the other recommendations that came out. We're going to go through those. You can get those in your report. So before we end up with the finance part of that, any questions about the housing recommendations that all of these different community groups and all have put together for you?
Well, it's more of a question about all the recommendations, and how are we going to track when they get done, or how they get done, or where we are in the process of getting them done?
That's a great question, because that's you guys' #1 job, is for that oversight. What we have done in the past is created a spreadsheet that outlined what the strategic objective was, what the tasks associated with those objectives are, who's assigned to them, what the anticipated completion dates are, the target dates, and then whether they've been completed or not. So I think the idea was to walk through something like that at the next session. Am I correct, George?
And the ongoing, long-term, hopefully, to develop a dashboard.
Oh, yeah.
To have a dashboard so that you literally, as everything is done.
So you can see it.
And I'll show you an example of a template that we do in other communities for strategic plans that has everything across there, the specific strategy, how do you break it down into action steps, who's responsible, by when, and you put that on your outward-facing community dashboard, so it becomes an accountability across the entire community. Like that, it's not just one entity, like you all will be providing the oversight and the monitoring, but you want community, you know, you got to step it up, and so having that kind of dashboard.
Can I follow up on that too? So are we going to choose at the next meeting which ones we think are priorities for this area, or are they all going to have equal priority levels?
I don't think they should have equal. I think there are some that are going to be more pressing than others, but I think that might be something that the continuum of care will be working on in terms of setting the priorities and bringing them back to you. Because they're the ones that's on the front lines, are doing the work, so we want to make sure that certainly that they're able to inform us about what they see as priorities and bringing those recommendations to you. I think that we certainly need to have a method to take bite sizes and bringing them to you. In other words, nothing that we discuss in these meetings after this plan is published should be outside of what this plan has established. And so we need to be able to let you know what we're going to be working on and reporting on future meetings, right? And then coming back with how those things went.
So the recommendations that you made were solely based on the interviews that you did, or was it also from best practices throughout the country? Was it kind of a mix of both?
Yeah, so 90% of these came from the community, and some of them were shaped by best practices. So in each of those small groups, I was able to present out. So if we're talking about services, what are best practices that we've used across the nation? And then people say, oh, well, we need something like that. It would look like this.
Okay.
And so that's how it was shaped.
Yeah.
One of the recommendations that came from the continuum of care when we presented this was that we look at developing I guess some type of structure of having one person like really just assigned to this board in the 10-year plan. So we're looking at how to do that as well.
That'd be great.
Any other questions?
Just a comment, of course, that our ultimate goal too is to go to our Board of County Commissioners, you know, with all of our work and encourage them to adopt the 10-year plan going forward.
Yeah, we're hoping to to present this to the board on October 23rd during a workshop session.
Can you make sure we?
Yes, so October the 23rd, we'll send you guys an invite.
And in a perfect world, we report our, successes to them annually, on an annual basis. I think we sort of didn't do that under the first, even though we have achieved a number of those priorities under the original 10-year plan. I don't think we've done a great job singing our successes, but they've certainly been there.
Yeah, we did present in January of last year, right around the budget session. And then we turned around and did the July session where George kind of walked through the accomplishments. But part of your oversight responsibilities are to do an annual presentation to the Board of County Commissioners as well.
So when does the current 10-year plan expire?
This year, I think September.
Okay, so and this is gonna replace that?
Yes.
Okay.
And we're looking to do an unveiling of this plan, and after everything is condensed on November the 15th.
Oh,
So
good.
there'll be some type of unveiling. We have, a group of people working on that as well.
I would make sure your unveiling is after the new county commissioners are installed.
Is that after November 15th?
I think it is.
Well, yes, what is it, the last?
22nd,
Yeah.
something, usually the last
20,
something.
I think you'd be missing a third of the county commissioners. I have a suggestion to you. A lot of this stuff is multi-other agencies. When we had the 10-year plan last time, we had a joint workshop with the school board, the Children's Services Council, the Healthcare Taxing District, and the county and the cities. And that's the time you sit down to them and you pre-sell it into them and said, okay, at this meeting, who's going to step up and do what? Because this is multi-funding agencies, and those meetings are usually pretty powerful, and we don't, I don't know if you guys still do them, but it was pretty impressive to be able to take a look at this. So the healthcare stuff is obviously, and then also, I think you could get the Children's Services Council more involved in homeless kids. They're not. And the school board could leverage that going forward too, because they have to watch over those families. So I'd just make sure you get the new commissioners, and I would jump pretty quick on that joint workshop, and Mr. Mayor, you could call that in a minute, they'll all come.
Thank you. And just with the financials, at the end of the day, it comes back to the financing and making sure, one of the things that when we talked to, we pulled the funders together, and they were saying they're in. They've been investing in this, and that if you bring them a big project, that they'll figure out among themselves how to actually put it together. So say, for instance, if you wanted to develop, and I'm making up a number 100, supported housing units, that they'll figure out who does the capital, who's paying for the operating, who's paying for the services, but they're saying that they're in. So make sure that we're bringing them to the table, and then of course joining funders together to end homelessness. Okay? And so just to finalize, there's some system level things. We always, as you were saying, it's across different systems, and we need to make sure that we're avoiding unnecessary duplication of services. So looking across all the sectors, what is everybody bringing to the table? Making sure that even through our local coordinated entry system, that we're really making sure that it becomes sort of a clearinghouse for all of the services and housing that's needed. Bringing in our employees to the table, creating an education campaign about homelessness methods that the community can take out and use, adding more diversity to our planning and our implementation table, making sure that we're as inclusive as possible. And then, of course, our next steps, just developing action steps and timelines and create a racing that I called it. So basically, for every single action step, a racing says who's responsible, who's accountable, who needs to be consulted because there has to be a large decision made or some money put forth, and then who needs to be informed. Okay. And here's an example that we've used across the country that's pretty, and I just did one for looking at your faith-based community of how you could utilize. But we're talking about for every single strategy, making sure that we have this kind of detail in terms of who's doing what so that nothing falls through the crack. And we'll figure out how to communicate this in a way, whether, a dashboard or a different kind of report, but this is the kind of information that we'll make sure that we're capturing for each of those strategies. Okay. Any final questions? Comments? Everybody still awake? Did we lose some folks? Okay, thank you.
Thank you.
Thank you.
I want to thank Regina for presenting this to us. This is great stuff. This is really good. Any questions for Regina or the board? All right, so since no questions, we'll go to the next item, staff comments.
Yeah, I'll make this quick because some of this we got to infuse into the conversation earlier. So we'll certainly circle back around on the November the 15th date. Jeff, I think that was a good suggestion. The November 15th date for the unveiling. So we'll circle back around and see if we can find another date for that. Just to give you an update, we spent 3 days in Miami looking and diving into the cottage homes project. The 18 to 21 units that we're looking to develop on the south end really had some great in-depth discussions with subject matter experts and architects and structural engineers and others. We're moving forward with attempting to demonstrate a small lot project to put a package together that can show that we can develop housing on small lots for an affordable price. So we'll keep you posted as we continue to progress with that. We've also taken a look at the first kind of sketch of the HRC2. So it was really exciting to be able to look at that and to start moving that forward. And we'll be presenting to the board. We're aiming for September, but we just kick the can down the road so many times. We just don't know, depending on what the board's priorities are. But it's really exciting to see how the HRC2 piece is unveiling. And our strategy now is to really solidify how we're going to fund the operations. So we've had some initial discussions about what that strategy looks like. We'll be keeping you posted moving forward. I just wanted to mention that there is some legislation that has been introduced to assist with VASH vouchers. I know we have our Veterans Affairs here with us. We know that it is a struggle to house many individuals, but we also know that there are resources at the federal level that are available to house our veterans, but there are some barriers that have prevented us from bringing down those resources to our county. So Senate Bill 2750 is a bill that has been introduced by Senator Nelson and Senator Rubio. And it really aims to remove some of the barriers with regards to case management support that is needed and some other things so that our veteran administration can release the funds to the local communities. And, well, actually local communities can accept the funds if we can house our veterans. And we're working on an initiative to reach functional zero with our veterans as well. So we have a team that is coming together to look at what that looks like and to develop strategies to end veteran homelessness here in Palm Beach County by HUD's definition. So we'll keep you posted as we continue with that. And one last thing I want to mention, we had a great meeting with our faith-based entities in July. So that list that is on the wall is just a partial list. We've updated it since then, but it really outlines across the top all of the different services that our faith-based entities can offer to help leverage resources and leverage funding, and what they have kind of committed to doing. And so we have a tour. St. Anne's has been kind of at the forefront, presenting to these groups, talking about what does it look like to have showers, to provide all these types of services to individuals experiencing homelessness, and really piquing individuals or entities' interest in engaging in this effort. So we're going to have a tour at St. Anne's for those churches that are interested in bringing showers and lockers on their property on September the 11th. And also, we're organizing with the Hunger Relief Plan. And so Julia was at the last meeting, and we have a group of faith-based entities that are really interested in coordinating better with as it relates to food. And so we're really looking forward to that. And then, of course, the coordination with the continuum of care, engaging in HMIS, providing rental assistance to clients. All of those things are happening as well. So as we continue to move this effort forward, we'll continue to give you guys updates on how that is going. We've also done some kind of restructuring internally so that we can have one person really focused on engaging the faith-based entities, and that has been helpful to us. All right. All right, any questions? There's an advocacy training that our Legislative Affairs Office is doing on Friday. So we have the Human Services Coalition that comes together for the Green Book and the priorities. We're a part of that. Maryland is kind of our, the Homeless Coalition is our advocacy wing. And so she's going to be coming and talking to all of us about how we can get legislation introduced and how we can get it passed, what that advocacy effort looks like. So if you're interested in that, we can certainly send you that information as well.
Is Marilyn giving the training, or is
No,
Rebecca giving it? Okay.
she's our
Okay.
she's the representative, because we have another meeting that we have to attend as staff. We may have a couple of other people there, but Marilyn is a representative. And of course, the Homeless Coalition, that's the Homeless Coalition, that's their world. So so we want to make sure that they're plugged in. Okay, I don't have anything else.
All right. Thank you very much, James. Public comments? Anyone in the public?
Just a reminder that there is a fundraiser for the Lewis Center coming up October 3rd. It's the Lewis Center Luncheon, and you have little save the dates on your desk there.
All right, so we have October 3rd at 11:30 a.m. the Lewis Luncheon.
I wanted to remind everybody that the homeless summit at VA Hospital is September 7th. If you didn't get an invite for that and you want one, let me know. Try to send it out to everybody.
Can we just send it to the, if you can send it to Kiana, we'll just send it to the entire board. There's a reentry summit that's coming up. We'll send that to you as well.
Member comments? Any members have any comments?
I have something. There was a piece on NBC on Sunday about homelessness. I think it would be great for everyone to see that. It's a great reminder of why we're doing what we do. James, I don't know if you want to have it sent out to everyone. It's really good. They talked about homelessness in LA. It's a great piece.
And it's on our website. If anybody wants to go to our website, you can actually show it.
Chris is coming down here. Who was on that piece?
Oh, is he? Because we're actually thinking about trying to. Oh, okay. Well, there's a guy there who who was formerly homeless, and now he kind of goes around and record, these people who are homeless. We're actually going to see if we can get him to come to our next year Lewis Luncheon to be a speaker. That would be good if we could get him. But you should watch the piece. I mean, it's a powerful piece.
I have a quick question. Is this available online?
Yeah. Yes, this homeless resource guide is available online. It's going to be tweaked and updated. I just have a few more copies left. I need to get them out, but
So it's not available yet?
it should be available on thehomelessplan.org. I'll make sure. I think it is. We may have taken, I know we had the wrong copy up there and need to replace it. But the idea is, if you can see on page 3 and page 3, we expect this list to expand pretty dramatically once the organizing with our faith-based entities is kind of been set. So, so this is available for now, but we're expecting it to change. And we also have, we've done a soft launch with our coordinated entry, where our prevention clients are now calling the Lewis Center. So this will give us a little bit more time in the month of September. We're going to pull the team together and evaluate how it's gone for the last couple of months and where we need to make tweaks so that once we put it on this, then we'll have some of those tweaks, those issues ironed out before the entry.
Great, thank you.
Any other comments? All right, with no other comments, our next Homeless Advisory Board meeting will be October 24th, 2018. Meeting is adjourned.